Have you ever felt an inexplicable weight on your heart, as if a storm is raging within, even when the skies seem clear? Depression isn't just a bout of temporary sadness, it's the world's leading cause of disability. In the United States alone, nearly 10% of adults face this overwhelming challenge. Unlike everyday feelings of disappointment, triggered by a bad grade, a lost job, or even a gloomy, rainy day, clinical depression is a persistent medical condition that refuses to vanish with time. Imagine feeling trapped in a loop of low mood, diminished interest in your passions, disrupted sleep, or even overwhelming guilt for no apparent reason. When these symptoms endure for at least 2 weeks and interfere with work, play, or love, they signal a deeper problem. What sets clinical depression apart? It's not simply feeling blue, it's a complex interplay of physical and emotional changes. On a grand scale, studies reveal that depression can alter brain structure. Smaller frontal lobes and reduced hippocampal volumes are common findings. On a finer scale, neurotransmitters like serotonin, norepinephrine, and dopamine become imbalanced, circadian rhythms falter, and hormone levels, think high cortisol and disrupted thyroid function, go off track. Neuroscientists are still piecing together this intricate puzzle, as depression emerges from a tangled mix of genetics and life experiences. The challenge? Its symptoms are often hidden beneath a facade of normalcy, making it hard to identify who is truly suffering. In fact, the average person battling a mental illness waits over a decade before seeking help. But there is hope. Effective treatments exist. Medications can help balance brain chemicals, while various forms of therapy guide patients towards recovery. In more severe cases, methods such as electroconvulsive therapy, which induces a controlled seizure to recalibrate brain activity, and newer options like transcranial magnetic stimulation offer promising relief. If you suspect someone you care about is struggling, gently encourage them to explore these options. Sometimes, a small gesture like researching local therapists or drafting questions for a doctor can make a monumental difference. Remember, depression is a medical condition, not a sign of weakness. It's no different from having asthma or diabetes, and recovery begins with acknowledging its reality. Talking openly about depression helps break the stigma, fostering an environment where those in need feel safe to reach out. Studies even suggest that simply asking about suicidal thoughts can reduce risk, paving the way for critical conversations and timely intervention. So the next time you or someone you know battles the shadows of depression, know that help is within reach. And every open dialogue brings us one step closer to a brighter, healthier future. As you reflect on this narrative, consider the invisible battles fought behind every smile. Let empathy and understanding guide your conversations about mental health. Each small act of compassion could ignite a spark of hope in someone's dark night. Embrace the idea that understanding depression can reshape our view of strength and vulnerability. May this insight inspire you to support those in need, nurturing a community of care and resilience.